You are joining your conference as a participant. For a menu of available commands, press *#.
Good afternoon and welcome to the FEMA Region 2 Individual and Community Preparedness webinar series. My name is Allison Albright and I'm the Regional Preparedness Liaison for FEMA Region 2. I'm going to provide a few technical considerations before we begin. Today's proceedings are being recorded and captioned in English and in Spanish. The archived event will be available on the FEMA website in the coming weeks. You should hear audio through your computer speakers, so please ensure your speaker icon is green and your volume is turned up so you may hear the proceedings accordingly. We will have a question and answer session after the presentation concludes. In a few minutes, you'll see a Q&A pod on the right-hand side. Please feel free to submit your questions about the subject matter there, and time permitting, we'll do our best to answer them. Finally, the PowerPoint presentation and other resources from today will be available for you to download and the file share pod as a PDF during the question and answer portion of the webinar. With that, I'd like to turn it over to the Region 2 Community Preparedness Officer to introduce our speakers and today's proceedings.
Thanks, Allison. Now that there are authorized and recommended COVID-19 vaccines in the United States, accurate vaccine information is critical. Today we'll be hearing from a panel of medical and public health experts who will address your concerns about the vaccine, as well as highlight community approaches and tailored messaging to foster vaccine confidence. Good afternoon. I'm Debbie Costa, the Community Preparedness Officer for FEMA Region 2. On behalf of our team working to strengthen preparedness across New York, New Jersey, Puerto Rico, and the Virgin Islands, I'd like to welcome you to our preparedness webinar series. The Region 2 Individual and Community Preparedness Program is focused on preparing individuals and communities for disasters by providing useful information and training, inspiring people to act and be ready for any emergency. This webinar was developed in partnership with the HHS Office of the Assistant Secretary for Health, OASH, Dr. April Smith-Herak, who serves as a Regional Health Administrator for HHS Region 2, will kick off this webinar by providing a federal update and overview on the COVID-19 vaccine. As Regional Health Administrator for the U.S. Department of Health and Human Services, Dr. Smith-Herak is responsible for public health leadership across HHS Region 2 and assists in policy delivery in several areas, including COVID-19, health equity, opioids, and chronic and infectious disease prevention. In addition, Dr. Smith-Herak is responsible for the administration of the Regional Office of the Assistant Secretary for Health programs in minority health and women's health. April, I'd like to hand the mic over to you.
Great, thank you, and hello everyone. I'm very happy to be here today, and we're thrilled to be co-hosting this with FEMA Region 2. Today, you're going to hear from a lot of really wonderful speakers addressing COVID-19 vaccines, and you're going to get much more in depth with many of them. But my goal was to tell you a little bit about myself, what our office does, and also just a little bit about the process of the development of COVID-19 vaccines and what the current status is on those and what you can expect for today. So here is our very, very tiny org chart, and I don't know if you can see, but up at the top there is Secretary. The Department of Health and Human Services encompasses a number of agencies and what we call operating divisions that you've probably heard much about. We house CMS, we house the FDA, we house CDC, and a number of others whom you may work with on a regular basis. We also have, on the outside of this org chart, many assistant secretarial offices. So my Office of Regional Operations comes out of the Office of the Assistant Secretary for Health, and we promote the priorities of the Assistant Secretary for Health. We also house the Surgeon General in our office. So the regional health administrators are the senior public health officials in the region, and you can see here our region looks really tiny, but boy are we mighty, and we really do actually encompass 10% of the population of the U.S. So it's pretty impressive when you look at our geography, but we are Region 2. We have New Jersey, New York, the Commonwealth of Puerto Rico, and the U.S. Virgin Islands. We also have 8 federally recognized tribes in our region. One plug that I wanted to make to all of you is that this is actually, April is National Minority Health Month. And for 2021, our theme is vaccine ready. And it's very important to us that we promote the uptake of COVID-19 vaccines, especially in disproportionately affected communities. You can find the Minority Health website here for more information. And even though it's towards the end of the month, there are a lot of great activities still happening, and there have been a number of activities that have been recorded. So what I wanted to talk to you a little bit about is how the federal government develops clinical trials, because I think to many of us, as the clinical trials for COVID vaccines were progressing, there was a general question of, well, how is this different from a normal clinical trial process? And how is it that we were able to do this so quickly? And is that safe? And I think that the short answer is yes. It is safe. And what you'll see here is a normal clinical trial process where you have a phase 1, which is just a few very healthy volunteers. In phase 2, you expand to several hundred. And in those early phases, you're really just trying to assess the safety more than even the efficacy of the potential vaccine or whatever the drug or device that you're working on is. In phase 3, which is the trials that you've been hearing about, those have usually 1,000 or more volunteers. The COVID-19 vaccine phase 3 trials that you've been hearing about have tens of thousands of volunteers involved in them. And what you've probably heard is that we started with adults of over 18 years old, and what we've done is each company, as they would like to pursue approval or emergency use authorization for a lower age group, will do bracketed trials. So you'll hear that 16 and up, 12 to 18. 5 to 12 will be different groups that would be studied in the phase 3 trials. Now, we are actually, for most of these vaccines, really not quite at phase 4. It is not, none of these are finally approved by FDA. What they are is an interim approval process called an emergency use authorization, which means that the data is sufficient enough that we have reviewed and feel confident in the safety and efficacy of the vaccine. And while that vaccine is going through that phase 4 approval process, the emergency use authorization is in effect. So all of these vaccines are in the process of applying for final approval, but they are still able to be administered based on the data that was submitted from the phase 3 trials and reviewed. So when we're looking at the safety profile of COVID-19 vaccines, it is absolutely a top priority that the vaccines be as safe as possible. So they are being held to the same exact safety standards as other vaccines. And in fact, some of these vaccines have better safety profiles than some normal vaccines, which is amazing considering the very, very high bar that we set as a federal government for approval for vaccines. So these vaccines were reviewed by FDA. You may have heard the term ACIP, the Advisory Committee on Immunization Practices. They advise the CDC and the FDA on the safety and recommendations for use for any vaccine. And so they have been meeting regularly, and you may have heard about their meeting on the J&J pause, which we'll go over really quickly on the next slide. But they are also monitoring safety and the effects of the vaccines after the administration. So one thing to know is that the ACIP determination on the Johnson & Johnson vaccine, that pause was actually a very normal part of vaccine development. So that pause was intended to allow the experts to review signal data. So signal data is what we get when we have adverse events that are initiated through either the VAERS system or another safety system. There are several safety systems that are recording potential adverse events. And when I say an adverse event, something that would be reported into VAERS, which is the Vaccine Adverse Event Reporting System, might not actually be an event that was associated with a vaccine. It just happened to happen within a reasonable amount of time of the administration of the vaccine, so that we would be able to look at it and say, that could be potentially related to the vaccine, then we investigate. So not all of the things that go into VAERS are actually side effects or results of vaccination, but they are potential results. So what happened was we started seeing many of these reports in, and by many, I mean about half a dozen. And because of that, and because of the status that it is, EUA, these vaccines are being very, very closely monitored. We want to make sure of their safety. So that pause was something that was very normal. And the pause was to allow the experts to review that signal data and to determine whether the data indicated that there was a link between the adverse event and the vaccine. And if there was a link, what was the general population risk? Was this something that was limited to only a portion of the population? Was there something that was a determining factor? And if so, are there any new limitations that we need, or are there protocols? So for instance, in the very beginning when we started administering the mRNA vaccines, the Moderna and Pfizer, we began seeing some anaphylaxis. And when we saw anaphylaxis, what we did was we looked to see, okay, it's not a very common reaction. It's actually less common than with some other vaccines, but we do know that some vaccines in very rare instances can cause anaphylaxis. So what did we do as the federal government? We sent out EpiPens, we changed the protocols, we made sure that everybody was monitored for 15 minutes because we saw that most of these anaphylactic episodes happened in the first 15 minutes. So we made sure that if you were one of those very rare people who had a reaction, that you would be able to get access to care for that reaction. And that was exactly what was going on with the Johnson & Johnson vaccine. So the experts did determine that the benefits of the vaccine outweigh the risks. In total, we had about 15 cases of this very rare blood clotting, and that was out of millions of doses that had been administered. Frankly, the risk of developing blood clots with COVID is actually higher than the risk of developing this thrombocytopenia with the Johnson & Johnson vaccine. So the benefit does outweigh the risk. The pause was normal, and now that the Johnson & Johnson vaccine has resumed, it shouldn't make you feel that it is necessarily any less safe. In fact, I hope that you feel more secure that anytime we do see one of these signals, whether or not we know what's going on, then we will go ahead and investigate that. And if it does pose a risk to the American people, then we will pause, and we will extend a pause or remove the emergency use authorization. So that's how the process is working these days. And I just wanted to now transition a little bit into today's webinar goals. We are addressing concerns associated with the COVID-19 vaccine today for you, and we wanted to share as much timely and accurate information and highlight tailored messaging and approaches that you all can use in your communities to help foster vaccine confidence. We're going to share resources and updates. And you will have a panel of medical and public health experts that are here today to help address your concerns and provide that accurate information. And we're going to be able to engage with the community on vaccine-related efforts through our interactions with them. So I am happy to answer any questions that I can. And I'm not going to, unfortunately, I will not be able to remain with you. I've been called away to a meeting at 2:30. However, there's somebody from my office, Marlene Vignier, who is our minority health analyst, and she will be very happy to answer any questions or convey those questions to me and provide you with any contact information you might need. And you're in great hands with the amazing experts that we have lined up for you. So thank you very much, and I'm going to hand it back to Deb Costa.
Thanks so much, Dr. Smith-Harris. We have a great panel of speakers today. Our first speaker will be Dr. Julian Watkins. She is the Senior Clinical Advisor to the Deputy Incident Commander of the COVID-19 Emergency Response at the New York City Department of Health. Give me a second, my apologies. One of the few people in this world who still has a landline. Dr. Watkins I mentioned, is on the staff of the New York City Department of Health and Mental Hygiene and lead for the Staff Immunization Justice Work Group, a group tasked with empowering city staff and providing information on the available COVID-19 vaccines and addressing vaccine hesitancy. He is also a Culture of Health leader. Culture of Health Leaders is a national leadership program supported by the Robert Wood Johnson Foundation. It fosters collaboration between people from all fields and professions that have an influence on people's health to build just and thriving communities. Our second speaker, Migdalia Jimenez, Mickey, is the Regional Director for Acacia Network. Throughout a 35-year career in healthcare, Mickey Jimenez has demonstrated a fervent passion to help others in their moments of greatest crisis. Mickey began her career as a registered professional nurse in an alcohol detox unit. In 2015, she came full circle when named as Director of Camino Nuevo, the area's only bilingual drug treatment clinic, a position she held between 2015 and 2018. As a founding member and now Executive Director of Capital District Latinos since 2019, Mickey has demonstrated an unflagging commitment to improving the lives of the region's Latinx community and other communities of color. Our third and final speaker today is Dr. Damalee Campbell. She was educated in New York City Public Schools and the New York State University, and she is a physician board certified in both obstetrics and gynecology and addiction medicine with clinical practice in Newark, New Jersey. For 2 decades, she has practiced to improve the care for underserved women. In addition to her clinical work, her special interests within women's health include broadening health education, and she has spearheaded a number of programs focused on community women's health, like promoting and supporting breastfeeding and widening nutrition education and labor support for pregnant women. She is also the current president of the New Jersey Medical Association, a local affiliate of the National Medical Association, which works with physicians of color on a local level to reduce health disparities. I'd like to turn the floor over to Dr. Watkins to get us started.
Hello, everyone. So yes, my name is Dr. Watkins. I'm really happy to be here and really excited to talk a little bit about New York City's vaccine program and also talk about some of the science and background of the vaccines. And we'll hop right in. So talking about the City of New York's vaccine program, we're calling it the Vaccine for All campaign. Our major focus is on the equitable distribution of vaccines, but really making sure that we talk about and acknowledge a lot of the history and the current experiences of racism, bias, exclusion of a lot of folks within our city in healthcare and in other aspects of their lives as well, and how it's been demonstrated in how folks have been affected across the city and impacted by the COVID-19 pandemic. So we're working to ensure both confidence and access to the vaccine, and it's a multi-agency operation. So we have a group called the Vaccine Command Center that's working with folks from the New York City Department of Health and Mental Hygiene. We're also working with New York City Health and Hospitals. We're working with the Test and Trace Corps. We're working with New York City Emergency Management and a lot of other city agencies to staff our mass vaccine sites and also outreach across the city. We're also working with federal and state partners, and we're also, I think most importantly, we're working with a lot of community organizations to really get out into communities and reach the folks who are beyond the reach of the health department. So for enhancing access and building our confidence, we're really focusing on equity and using some of the principles of compassion and trust, trying to be as inclusive as possible. We'll talk a little bit about how we post our data. We collect data, and we want to make sure it's all transparent, and we update it regularly on our website. The data so far is showing that there are disparities across the city in vaccine uptake. but this reflects a national trend, and so it's an ongoing process of prioritization and modifying like eligibility criteria. Recently, New York City was able to, all of our city-run sites, any person 16 and older can walk into any of our sites and get vaccinated along with a companion. And also it's really trying to acknowledge that there are factors that contribute to the lack of confidence within communities, especially given some of the circumstances that communities have been faced with and live under in New York City. We've identified 33 neighborhoods across the 5 boroughs as racial inclusion and equity task force neighborhoods, where these neighborhoods which were affected disproportionately by the vaccine, by the virus rather, we're actually we're sending resources, sending folks on the ground to meet the needs of the communities, and not just bringing the vaccine, but also giving folks access to other resources. For enhancing access, we're expanding beyond the mass vaccine sites. So we're working with distributing vaccines to pharmacies and local providers, understanding that a lot of folks do want to see their routine medical providers and go to their healthcare home to receive the vaccine. So that's something that we're working on. In terms of making appointments, though appointments are not necessary, we do understand that people do appreciate having a time and a date to go and get vaccinated. So all New York, folks living within the 5 boroughs can go to the vaccinefinder.nyc.gov website. There's also the number. We're also working on having healthcare providers be able to actually call in and set an appointment at one of the vaccine sites for their patients if they'd like. We also are working with the Department for the Aging and working with the New York City Fire Department to have the home vaccine program. We were using Johnson & Johnson. During the pause, we've actually been able to use the Moderna vaccine, but we are restarting with Johnson & Johnson, and that's a really encouraging program. A lot of folks have signed up, and these are folks, through this program, folks are actually able to be vaccinated in their homes by healthcare professionals and monitored after. We also have free transportation options available for seniors so that they can get to and from the vaccine appointment. And we also have language access at all the city vaccine sites. We encourage folks who speak languages commonly spoken within neighborhoods, but we also use translation services as well. For building confidence, we have a lot of trusted messengers who are working with communities and helping community leaders become trusted messengers. So we do this through various ways. We have a lot of town halls, reaching various groups, various identity groups and ethnic groups across the city. We're also having a lot of community conversations where we can actually have time and space for question and answer and to address concerns. We also have a lot of folks who are involved in what we call train-the-trainer sessions, and through these trainings, community-based organizations are able to get training from the health department and materials so that they can actually go in the communities and have these conversations themselves. And then we have a lot of volunteers and a lot of folks within community-based organizations, faith-based organizations who are working on the ground, who are canvassing, who are passing out flyers, palm cards, fact sheets, putting posters up, going in and out throughout the communities that they live and work in to really spread the message. It definitely has a grassroots feeling, which feels really encouraging. And I think as we talk about vaccines, a big thing that folks at the New York City Department of Health never want folks to lose sight of is that we are in this global pandemic, and this virus is easily transmissible from person to person through respiratory droplets. And as of yesterday, over 572,000 people have died in our country. And in New York City, specifically, over 32,000 folks have died. And so we take this message, and we really want to make sure that folks don't lose sight that we're talking about vaccines because we have this deadly virus. And we can see how it's acting throughout the other parts of the world when we look to to India and parts of Latin America, just really understanding how dangerous this virus is. And so the New York City Department of Health and Mental Hygiene, we post all of our vaccine data online. It's readily available. We have some interactive maps and graphs so that folks can kind of get a more hyper local zip code by zip code view of what's going on in their neighborhoods, so folks can understand that even though the citywide average may be at a really comfortable place. As you can see in the map to the left, the darker the color, the higher the percent positivity. You can see that it's not evenly distributed. So really making sure that we approach our community engagement using these principles of clear communication to not only inform but educate people of their risk, and also to educate folks on the benefits of the vaccines. This is just some more data that we have available at our New York City Department of Health and Mental Hygiene website. We break down percentage of folks vaccinated by zip code. We also gather that information and share it by race and ethnicity group. Over 50% of New Yorkers 18 and older have gotten at least one vaccine, and more than 1/3 have been fully vaccinated. And this data is constantly being updated and modified based on community feedback as well. So to wrap up, I'll just cover some of the vaccine basics and talk about how when we engage with the community and when we talk with medical providers and community advocates, giving some really some high level or really good pointers of how you can actually communicate effectively around the vaccine. So when we talk about vaccine safety, as mentioned earlier, the Johnson & Johnson vaccine, the pause, some folks have felt, a lack of confidence, or they've been shaken a little bit by seeing, what the risk that the risk of this disorder that has been identified. And I think, this does actually really show these safety systems working in real time. And it was important to get the message out to medical providers that this atypical presentation of this disorder, the cerebrovenous sinus thrombosis with low platelets, that it was an atypical presentation, and I think for safety, I think it was important to raise a level of awareness and consciousness of medical providers to let them know how to treat and manage this very rare complication. But I think it was also important for folks to do information gathering to learn more about if there's any causality. So it's a process working in real time. There's a lot of folks in the community who were talking about the VAERS system, this vaccine adverse event reporting system, and I think it's like speaking to the fact that it is used, it is monitored, and we'll continue to monitor that. In terms of the vaccines that are recommended, folks have asked, well, if I've had COVID in the past, I'm good for 90 days, or if I have antibodies and I never had symptoms, I'm good, I don't need it. The messaging is you actually do need the vaccine. I shared the data, over 500,000 folks have died in the country so far. Any level of protection that you can have against this virus, especially now that we have proof that the available vaccines are offering protection in the settings of some of the variants. I think it's important that we really remind folks that this deadly virus is a real factor, and these vaccines do many things well. They prevent death, they prevent hospitalization, they prevent severe illness, and I think there's also evidence that they can actually prevent infections. So those are three things that we're also sharing with folks when we talk about the recommendation. Another key vaccine basic message that we like to address is the fact that the vaccines do not contain the virus that causes COVID-19. This is where we address the educational point of, as the Department of Health and Mental Hygiene, helping folks understand what the vaccine or immunization process is, how the mRNA vaccines are working with the mRNA, with the system that our own cells are using and operating with every day, educating folks that mRNA is actually a building block of life, just like a DNA, as folks may be a bit more familiar, and our bodies are well equipped to manage and handle mRNA, and also break it down when it served its purpose. So really speaking to that, and also helping folks understand the Johnson & Johnson vaccine and the adenovirus vector as another method of inducing immunity with a similar outcome of producing that primary or that immune response to activate antibodies and also immune cells, so that we can have that protection against this deadly virus. And also framing it to help folks understand that there's a natural, as we live in the year 2021, and people have new technologies and we see new iPhones, and we see all this new technology in other fields and sectors, but in healthcare, we also have a lot of scientific advancements. And these vaccines are the latest iteration of vaccine technology, and it's really encouraging and really significant to think that within a year, we were able to produce vaccines that were extremely safe, still extremely safe and extremely effective, and able to be mass-produced at the level where over 1 billion people have been vaccinated in the world. So really selling the vaccine or letting folks understand that this vaccine is actually a medical marvel, and I think it's extremely significant and one of the best ways to get us out of the pandemic, locally and globally. And also, the vaccines do not alter our DNA. The vaccines do not contain microchips. They're very advanced in their technology, but they are not that advanced. And also letting folks know that we're building on a lot of history and a lot of understanding. So those are the main basics that we kind of talk about when we talk about vaccines. The 3 vaccines that we are vaccinating folks in New York City with are, again, the Pfizer and Moderna. We're also vaccinating folks. We've restarted with Johnson & Johnson as well. And we're really spreading the message that it's vaccines and, you know, continuing to physically distance and washing your hands and avoiding large groups inside with folks if you don't know their vaccine status. And with that, I am finished. Thank you.
Mickey, you're up. Mickey, if you're speaking, you're on mute. You need to start your webcam. Hi, is Mickey on the line? Hearing nothing, perhaps we should jump ahead to Dr. Campbell. Allison, if you wouldn't mind moving the slide. Dr. Campbell, if you wouldn't mind jumping into second place here.
Sure, can you hear me?
Yes, we can hear you and we can see you.
Okay, sure. Great. So I'm going to talk about myths and conceptions, and thank you for inviting me to participate in the panel this afternoon. I recognize that I was likely extended this invitation because of my professional work with patients during the COVID-19 pandemic. But we're all influencers, and once educated, I really believe that some of our biggest impact is as community members, neighbors, friends, cousins, aunts, uncles, and relatives. So one of the things that I hope we will accomplish today is getting information and then sharing information. And so, as was mentioned earlier, April is Minority Health Month, and access to reproductive health care, which includes contraception, prenatal care and termination of pregnancy care, access to reproductive health care has disparities for women of color, for Black women, Indigenous, and for all women of color. Reproductive health care is essential medical care that is needed even during a pandemic, and it is time sensitive. Delays in care can negatively impact a person's health and can make some services completely inaccessible. So prior to 2020, many were becoming aware that we had a public health crisis in the United States. The United States, as an industrialized nation, has too high of a maternal mortality rate. The Surgeon General at that time, Surgeon General Jerome Adams, went on a listening tour through the U.S. And in my home state of New Jersey, First Lady Tammy Murphy championed the efforts of moving New Jersey from the 47th out of 50 in maternal mortality to trying to make New Jersey the safest place to deliver in the U.S. And we're still on that journey. This is not new. We've seen this negative trend in pregnancy-related mortality for the past 2 decades. And so April, being Minority Health Month, does align with initiatives to advance health equity across the country on behalf of all racial and ethnic minorities. But then COVID happened. And with the maternal health crisis as a backdrop, it's understandable that women are concerned, that women are worried and asking a lot of questions and having doubt in our healthcare system. And like in many states, in New Jersey, we saw disparities in COVID cases, COVID hospitalizations, and COVID deaths among people of color, particularly affecting Latinx and African American families. And so some of the questions that I get commonly asked are pregnant women more likely to get COVID? And so there are a few things to consider when we ask that question. So number one, we know that there are more women in the workforce, which increases people's exposure. What kind of work does the pregnant person do? Is it a job where they can work from home or not? Does the pregnant person have personal risk factors that may predispose them to more severe disease, like diabetes, cardiovascular disease, chronic lung disease? And who do they live with? Do they live in a multi-generational household? Does their partner or spouse have a job where they're able to work from home or not? So hopefully you can see a little bit of this graph I'm going to explain. But this is from Catalyst in 2019, and it's talking about people in the workplace. And basically, it's on the y-axis is the physical proximity to others at the workplace versus the exposure. And one of the things is that, first of all, women aged 16 and over represented 47% of the total labor workforce. And then you see all these bubbles, some which are small and some which are larger. And so the larger bubbles represent more people who do a job, a particular job, and the smaller bubbles represent less people who do that job. So you can see that in the far left-hand top corner, there are dentists, small bubble, and they have a very high exposure because of their physical proximity and their exposure to disease. So, just thinking about this, we can take a moment to reflect on women of reproductive age and what kind of jobs they do. My patients are frequently nurses, cashiers, personal care aides, child care workers, and so you can imagine with these type of jobs, many of them are not jobs that they can do from home. And also, what kind of transportation people use is also a factor. So pregnancy risk in COVID. Fortunately, most pregnant women who get COVID do well. But when we do compare pregnant women to non-pregnant women in the same age group, we do see that pregnant women have increased risk of admissions to the ICU, increased risk of intubation and needing ventilation support, and increased risk of death. We also notice that babies born to women with COVID-19 are more likely to be born preterm. And unfortunately, we know that preterm birth is a big risk factor leading to an increase in infant mortality. So what are some of the key facts about COVID vaccination? As was stated before, getting vaccinated can prevent persons from getting sick with COVID-19. Even people who have gotten COVID-19 already can still benefit from getting vaccinated. COVID-19 vaccine cannot give you COVID-19, and getting the COVID-19 vaccine will not cause you to test positive on a COVID-19 test. Another frequent question that I get is, will getting a COVID vaccine change my DNA? And the answer is no. COVID-19 vaccines do not change DNA. They don't even interact with our DNA in any way. The vaccines teach our immune system how to fight against this specific virus. So they teach our body how to produce the spike protein, which fights against this particular virus. And in order to do its job, the COVID-19 vaccine does not even need to go inside the nucleus of the cell where our DNA is kept. And so this means the vaccine never interacts with our DNA in any way and has no way to change it. So frequently, as I talk to patients who are pregnant or have recently delivered, again, they're wondering, should persons who are pregnant or breastfeeding get a COVID vaccination? And this was, at the top of our mind in the past year because unfortunately, pregnant women were not included in the clinical trials. And so there's very limited data regarding the outcomes in pregnancy. But I would say all of the major professional organizations, the American Society for Reproductive Medicine, the World Health Organization, the American College of Obstetrics and Gynecology, as well as the Society for Maternal Fetal Medicine, all support those seeking to be pregnant, those who are pregnant, and breastfeeding individuals to get vaccinated. And even the Male Reproduction and Urology Society and the Society for the Study of Male Reproduction recommend the COVID vaccine should be offered to men who desire fertility. And so, again, we know that getting sick with COVID-19 during pregnancy can increase the risk for severe illness and might increase the risk for negative outcomes and preterm birth. And so we are recommending that pregnant women can get vaccinated, particularly if they have risk factors for severe disease. If they have jobs that put them at increased risk, if they have medical problems that put them at increased risk, we're recommending that they get vaccinated. And it's also important, I personally counsel patients, as with many viral illnesses, that they can get the vaccination while breastfeeding, because as with all viral illnesses, breastfeeding passes on important and life-saving antibodies onto their infants. And so one of the best ways they can prevent their children from severe illness of COVID is by breastfeeding and passing on those antibodies by breastfeeding. Will getting the COVID vaccine affect my fertility in the future? And again, no, the COVID vaccine does not cause infertility. There's nothing about the vaccine that affects sperm or egg quality, and there's no reason to suspect that the COVID vaccination increases the chance of miscarriage. We do know, again, pregnant women were not allowed, were not knowingly enrolled in the vaccine studies. We do know that there were some women who became pregnant after they were vaccinated, and we are currently have clinical trials ongoing, particularly with nurses and other women who voluntarily have joined these clinical trials, and we'll be watching very closely to share outcomes with the public about these trials. And so as far as the key points that I hope to get across, there are many factors that will likely impact health disparities as we move through and past this pandemic. And it's really important that we have intentional actions, particularly among women of reproductive age. COVID vaccination is part of the toolkit for women, including those who are pregnant, postpartum, breastfeeding, and still have pregnancy in their future horizon. And I don't take questions about vaccination as hesitancy. I believe it's part of curiosity, and it's important to maintaining good health, and I welcome questions. When people ask me questions, I think that means they're interested in maintaining good health, and I think that's important to ask questions and to get more information. And I have some resources that will be shared with all, and I look forward to the question and answer period.
Thank you, Dr. Campbell. Mickey, I'm hoping that you're on the line, and we're all good to go. If you could start your webcam.
Okay, can you hear me okay?
I can hear you. I don't see you yet, though.
I apologize, everyone. I hit the, I had the mute button, hit speaker, and disconnected myself, so.
Okay, 1 second. Dr. Campbell, can you, okay, there, oh, I just lost connection, so. Okay, I'm hoping everybody's got the right webcam going.
Am I on, is the webcam, I could see, can you see me?
I just got kicked out of the room, so Allison, can you see Mickey on her webcam?
I don't see you yet. Do you see the Start My Webcam button, the top right of your screen?
Yeah, and I clicked on that. It says Region 2 Web Room. Okay.
So when you click on Start My Webcam, it should automatically just go right to it.
On the far right.
Right in the center of where Dr. Campbell was just now. It should say it right in the middle of that pod.
Right.
Okay, let's then just not use the webcam. Let's just move forward with the presentation.
I'm so sorry. I apologize. I thought I was connected. Anyway, good afternoon, everyone. Buenas tardes, and thank you for this wonderful opportunity to follow two incredible presentations done by both Dr. Watkins and Dr. Campbell, very informative. I'm Mickey Jimenez, and I'm the Regional Director for Acacia Network and Executive Director really here in the Capital District at Albany, New York for Capital District Latinos. Capital District Latinos is located at 160 Central Avenue. And you see I have a picture of the church because we're actually physically located in an old 130-year-old Lutheran church. And it's where we have been for the last 3.5 years. And Capital District Latinos is an acronym for Latino advocacy through inter-neighborhood outreach services, creating the conditions for success in the Latino community and other community of color. So I was asked today, and I really am honored to have this opportunity to talk a little bit about what we have found, what skepticism and mistrust challenged COVID vaccine among Latinos. And just to give everybody a little background, our cultural center, which is a cultural enlightenment center, was deemed non-essential when the pandemic hit, which meant that we had to actually close our doors down during the pandemic. What was very interesting working remotely and all the programming that we had projected for the year that constituted in bringing people together were canceled, and many of them were addressing health disparities. Things like having programs on preventing diabetes or hypertension, and which we had already been doing in previous years with the relationship with the Department of Health and Office of Minority Health and Health Disparities Prevention. And so when that occurred, even though we were shut down, the phone never stopped ringing. And what was interesting was that the calls that were coming in were not because people were concerned about getting the COVID, the coronavirus. What they were concerned was where are they going to get their next meal? Undocumented, where am I going to be able to get money? You know, restaurants shut down. So it was really interesting for us here at Capital District Latinos that we were facing another issue which we needed to address. And I say this because this is going to really showcase and highlight why maybe our clinics were a little bit more successful than maybe some of the huge hubs that did the vaccines going forward, because we actually continue providing services to the Latinx community, whether it was trying to get them to the doctor, if it was an emergency, or addressing food insecurity. So when we think about skepticism and the mistrust, everyone's aware of the long and recent history of the medical malpractice promulgated against communities of color by the federal government. And so, for example, in the U.S., involvement in the mass sterilization of Puerto Rican women and Mexican men and women remains a hidden and a dark part of the U.S. history that was a product of structural racism and exists in the healthcare and political system. And disappointingly, similar practices are still seen today. And a recent example found was evidence of the violation of the COVID-19 guidelines for hysterectomies and maltreatments at immigration detention centers where Latinos constitute the majority of those that were detained. So when we talk about the continued fear and mistrust of the previous administration, it's a major challenge. As you know, we were simultaneously going through this pandemic at a time where folks that were trying to get into this country were stopped. The stories here in the Capital District from folks that knew families that were trying to get in were endless. And so that became a challenge as far as having trust issues when we started to talk a little bit about getting vaccinated. Misinformation, and you heard doctors today talk about, there's so many myths out there. I most recently learned one, and I don't know if the doctors have heard this, but it was a medical doctor that had a Latina woman come to his office and say, yo no quiero esa vacuna. And she said, I don't want that vaccine because I'm anemic and I don't want my blood getting frozen. I heard that that arrived to the States in sub-zero, I mean really, really frozen. And although that sounds funny, that was a valid concern for that individual. That's how much information she even knew about how the packaging of that vaccine was coming in. So misinformation includes a lot of other mistrust that sometimes don't fit into categories that's just talking about the facts of the vaccine. The historical discrimination and employer bias is always something that has to be taken into consideration. And then safety concerns about the side effects, right? You know, folks have felt, and I know the doctors spoke about this today, how much time was really put into making the vaccines, right? What we poured into the system was millions and millions of dollars just to get these vaccines up and running. You know, so having to explain that in terms where that person can understand and feel more at ease is really, really critical. And so there's a lot of that time that has to be spent up front. And then the safety of the side effects. It could be what we just heard about the J&J, but when they hear about one person, that multiplies to, in their minds, it could be me, it could be my daughter, it could be someone I know. And then, of course, we were faced with the issue with the religious concerns. And that was something we heard loud and clear here. No, no, no. Mi pastor or mi cura, my priest or my pastor said I shouldn't get it because it has aborted fetuses. It was made out of aborted fetuses. And so those are, again, very common among Latinos who are very religious to take at face value from an authorized figure of faith that that's what they should do, and then pray that they are not going to be getting the virus. And then what we're finding is complacent. You know, they're complacent. They're just waiting to see who else is going to take it. Let me see if, you know, I'll wait. Let me wait and see a type of approach. So where I want to spend some time is really giving some examples, one to put here, of how do we overcome some of these barriers to increase the vaccinations among the Latinx community. Well, I can tell you that one of my biggest frustrations sitting on the governor's task force for the vaccination and implementation program here in the Capital District, and also sitting on the equity, has been how to convey the importance of messaging and education, but really taking our time and putting resources into that, more than just giving the facts about how great these vaccines are, but taking our time to listen and validate to that person at their level, what are their concerns. I use that example of that woman that thought that her blood was going to get frozen if she got the vaccine. Well, you know, if that doctor didn't hear her at that time, that would have been one myth that going out in the community that she would have communicated to others. And as we know, it's your circle of influence that really is going to help the neighbors in the community really come together. One of the basic things that I could not believe even here in the Capital District was when the vaccine clinics started to open, one of the things that we found quickly was that nothing was being shared in the other languages. So here we had one hub that providing 1,000 vaccines a day, and then we had FEMA doing the same in another site, and none of their information was in Spanish. And that was a big concern for me. I mandated that they get the information, and it was very easy, just even going on the CDC sites, getting the consent, having people understand what they were going to sign for, having the vaccine fact sheets in Spanish, not at the time that they're actually just showing up to get the vaccine, but giving it to the community leaders that can get familiar with those facts and break it down in language where that person is going to understand what that means. Not sounding too scientific, because you're going to lose that person. So one of the things that worked out really well was that we actually had like an educational session here at Capital District Latinos where we were just, if you're interested in finding out more information about the vaccine, give us a call. And then we started to have Zoom where we had doctors that spoke Spanish talking a lot about that and giving them an opportunity. And a lot of folks that signed up to the Zoom, they were very forthcoming with a lot of their concerns about it. And one of the things that we did right up front was not discounting what they believe, but validating. Well, tell me more. Can I speak to you? If it was a flat-out no, then we weren't going to spend too much time with that person that was saying absolutely no, but we said, can we talk to you in a week or 2 weeks? The ones that were kind of sitting on the fence, we gave a little bit more information. At the sites, we need culturally and linguistic interpreters. To have someone that speaks Spanish asking COVID questions and saying things like, can you tell me, have you had an autoimmune disease? Well, I had a couple of Latinos that said, I have HIV. I don't want her to know my status. And so all these things were taken into consideration. So when we had our clinic here, we ensured that the nurses, the folks that were vaccinating, were professional and knew that knowledge to speak so that that person would not deny having an autoimmune disease if in fact they did. Having vaccinators, healthcare professionals, we just had a clinic and we had the first-year medical students here, all bilingual. They were awesome. And where did they spend the time? Well, they were spending 15 minutes waiting after they got their vaccination, was truly explaining to them in language that they could understand what to expect once they went home as far as side effects. Simplifying this registration process to tell folks, oh, here's a website, get on it. First of all, we didn't have it in Spanish. One of the things we did was we asked all the hubs to give us the link. We did all the legwork. We did all the questions for that individual. We locked them into a vaccine. And this is one of the vaccine registration sites that you see here that we use. Vaccine training for a healthcare outreach team. We work with all the equity on what are some of the essential things that we want folks that are going out there and telling them, you should have it, right? But what if they say no? What if they say, how do you overcome these objections and still create some type of a rapport with that person so that maybe you can re-engage them in a week's time? I can tell you that we had 90 J&J vaccines that we were going to be giving out, and out of the 90, we were able to convert 75% to the Moderna the following day. The overall percentage in the Capital District was 2% of Latinos getting their vaccines, and at our clinic, our average is 54 to 70% Latinx. And I really do believe that it's been because of this hand-holding, and there are some incredible tools that you'll see for your review that gives you some real simple language and pictures that folks that are not professionals can really understand, and the folks that are doing outreach can use as tools. And I'm running out of time. I just have here that agreeing to a vaccine is complicated, and there's more information on that. We're all on a continuum. And identifying the person at the tipping point is really important because, you know, once you get them, this is the tough part, right, getting them up to the tipping point. But once you get them there, once you start getting them more information and they say yes, then the rest becomes a lot easier. And so this is something that I just wanted to make sure that we don't give up on people because they're sitting on the fence or simply saying no. Partnering up with other community-based organizations to build trust and confidence among Latinos has been essential. You know, I've partnered up with a lot of the restaurants that have undocumented workers, and they came. You know, the owners came and brought some of their workers. We assured them that ICE was not going to be here, and we simplified that process for them. In fact, as long as they show some document that they were living in New York State, and someone would attest to that, that was it. They did not have to worry once they got to the vaccination table. And I know I just ran out of time. So this is our mission, you know, here is to partner up with our community to lead the change and promote healthy and prosperous individuals and families. And those were some of the things that we did here to make it more successful in getting the Latinx to get vaccinated. And we are going to be continuing now with 2 outreach workers out in the community. And there's a lot of resources that you'll see available for you as well. And I'll take any questions. Thank you.
Thanks, Mickey. I'll go through the questions. I understand that we have 3 individuals on our panel, so I would just ask that that whoever feels that they're best suited to answer the question. And if any of our other panelists would like to add to that, please feel free to do so. So the first question we have from today's audience is, how long should you wait after your second shot to get a breast ultrasound?
So this is Dr. Campbell. I can jump in on that one. I don't know if there is an official answer on that, but what I do know is that I would definitely, if you can, call ahead to the imaging center to find out if there's a waiting period, because what happens once you get the vaccine is the immune response sometimes can make some of your lymph nodes enlarged. So I have heard of situations where people have had mammographies or chest x-rays that have presented some unusual findings, and they hadn't, the radiologist didn't know that the patient had the COVID vaccine, and they were trying to work out, well, what were these findings? And so once they realized the patient had the vaccination, they realized that that was probably the cause of the unusual findings. So I'm thinking around 2 weeks, but I would check in with the imaging center.
Thank you so much, Dr. Campbell.
I can add. Dr. Campbell, from what I've heard, 6 weeks was a recommendation.
Thank you, Dr. Watkins. How long should you wait to receive a vaccine after having COVID?
I can take this. This is Dr. Watkins. So the recommendation is actually after if you have COVID and you have symptoms, you should wait for your symptoms to resolve and for the clinical illness to end. So around 10 to 14 days, and then you can get vaccinated. You don't have to wait up to 90 days. That was an earlier recommendation. Or you don't have to wait until you have a negative test, like a PCR test. You don't have to wait for that to clear. It's about 10 to 14 days. That's all.
Thank you, Dr. Watkins. After I have my vaccination and pass the time that is required, why do I need to continue to test for COVID?
It's in I can take that again, this as well. So it's important to continue to test for COVID because, unfortunately, nothing is 100% effective. And vaccines are very effective, but they are not 100% effective. So the recommendation is at least once a month to get tested, even after you're vaccinated. And I would go further to say, if you're going to visit a family member who's 65 or older, or who has an underlying medical condition, or someone who lives with them, I'd recommend getting tested, especially if you're going to be inside, just for that extra level of protection and, safety, especially if that person is not vaccinated yet.
Okay. Are these vaccines, whether they're administered in 1 or 2 doses, are they only required as a one-time vaccination and we could add it to our vaccination chart? Or do you anticipate that people will have to take more doses in the future?
Looking at the way the world is going and with the advent of these newer variants, there's nothing to say that these variants won't continue to mutate. And so I think, it hasn't been said yet, but there's evidence showing that a booster may be necessary in the future. And there's actually research being done to kind of check what a booster would look like. So similar to the influenza, the yearly influenza vaccine, where they look at what variants are out in the community, they have the potential to do that for COVID-19 if necessary.
Thank you.
And I would just add in that, again, we don't know. One of the questions that we're still waiting to get a definitive answer on is how long does the immunity from COVID vaccination last? And so that's why we're not quite sure whether a booster is going to be necessary or not. It's looking more and more like that is the case, but the final answer is still out.
Thank you. Is it safe to take 2 different types of vaccines, for example, Pfizer and Johnson & Johnson?
No, the recommendation is to stick with what you start with. There hasn't been studies on people, taking one, switching to another, or being double vaccinated. I think that's something that we would see if a booster comes, or if what that would look like, and they would have more evidence. But I would recommend that folks stick with what they start with.
Okay.
Yeah, I think that as the doctor said, people, if you know what vaccine you got, you should get the same vaccine. If it's a 2-dose vaccine, you should get it. There is some guidance in the situation where someone doesn't know what vaccine they got. In order to complete the series, you can get a second vaccine, but if you do know what vaccine you got, you should get the second dose of the same vaccine.
Thank you, Dr. Campbell. I know this might seem like a silly question, but, should we be laminating our vaccination cards? Should we be keeping these for proof? I know at one point I thought that I had thrown mine away, and everybody was like, oh my God, what do you mean you threw it away? How are you going to prove you took it? And I'm like, who do I have to prove it to, Is this something that we should be saving and maintaining and possibly having to show as proof?
I don't know if you'd have to show it for proof, but I would say save it just like you'd save a birth certificate or a Social Security card if you have one. But I think living in the modern age, I just took a picture, saved it on my phone, and actually emailed it to myself. So whatever you can do to just keep track of that, I think that's good. Also, New York City, we actually have an immunization registry. So the city's actually keeping track of that for folks who are getting vaccinated. But I don't know beyond the 5 boroughs.
Okay. All right. Thank you.
Yeah, I think most states do have a vaccine registry, and there has been discussion about, people are talking about this vaccine passport. There are some countries that are asking for people to prove that they've been vaccinated in order to travel or to have a negative test. So I think it's a good idea to keep the vaccination card. I think it's a good idea.
I guess, because, me personally, when I got mine, it's not like it doesn't have an official Department of Health stamp on it. Somebody wrote it in. So how do you know what's fraudulent, it's just something that's handwritten. But that's good advice. How would you go about kindly phrasing the information someone is using to justify not getting vaccinated as inaccurate? So in other words, if somebody were to say, I'm not getting the vaccine because it has, aborted feces in it, how would you go about responding to that individual?
Yeah, so I would, what I would typically do in that situation is I would just, again, as was mentioned by one of the other speakers, I would validate the person's concern. So I would say something like, I understand your concern because some medications or some previous vaccines did use biologic materials in the past, but the way this particular vaccine is made, this does not have any material from fetuses. It does not have any live, virus. And I agree with Mickey in saying that when people are like, absolutely not, like, I don't try to go after them. I just, say, we're all entitled to our opinions, and, I hear you. Maybe we can talk again in a week or 2 weeks, or let me know if you have additional questions. So I think it's important to leave the door open for people to come back to us.
Thank you. What do you tell people who've had the vaccine but are still being asked to wear masks and keep social distancing? Why take the vaccine if you still need to, take these additional precautions?
I can start. It's important to take the vaccine, and even like children to take the vaccine. To wear masks. Wearing masks are really important because they are what got us out of the first wave, especially in New York City when over 20,000 people died that first wave, right? It's really effective at limiting transmission and protecting ourselves and others. And as we see, we're still not to the point where the levels of vaccination are where we need it to be. There are still folks being infected, thousands of folks a day. And so it's to protect yourself and to protect others, and also with these new variants, it's important to continue to wear masks, because as we learn, some of these variants do have concerning features where they may actually be able, eventually a variant may come that maybe actually, bypass the vaccine. So until we can get the rates of infection down and get folks vaccinated to the level we are, it's just for the safety of ourselves and others.
Okay, thank you. This next question is for Dr. Campbell. Can you let us know if there are any issues or concerns about the vaccines and breastfeeding? Are there any resources that you could share with our audience?
Sure. There are, early on in the pandemic, when we didn't have a lot of information, we didn't know what to tell women who were breastfeeding. I think we had the baseline knowledge, again, that breastfeeding, of course, is helpful because we know that breastfeeding offers so many benefits, including passing on immunity with antivirals for many different viruses. And there was no reason to think that this would not be the case with COVID, if women were infected. But the question is, of course, if you're breastfeeding, if you actually had COVID and you can't breastfeed, obviously, from 6 feet away, then how would women, deal with that situation? And so in the beginning, there were varying policies from different hospitals. Some policies were separating mothers and infants. I think we have a better handle on that right now. And what we're asking, if a woman is testing positive for COVID, We're just asking her to wear a mask if she's going to breastfeed, just because obviously you can't breastfeed from 6 feet away. And there are resources, the Academy of Breastfeeding Medicine, American College, in terms of actual patient resources, things that are at the patient level, is the CDC and the World Health Organization have patient resources. But for professionals, then I would go to the Academy of Breastfeeding Medicine and the American College of Obstetrics and Gynecology.
Thank you for those resources. There seems to be a significant amount of data being collected on specific populations. Is anyone tracking data on the LGBTQ+ community?
New York City is collecting that data. It's not being reported out, but that is part of the data that we are collecting. Hasn't been reported out yet.
Okay. All right. Thank you. Why do children need the vaccine under 16 if the virus doesn't really make them very sick?
People of all ages have died from COVID-19 in children, including young children. And so because of that risk, it is encouraged that, every person gets vaccinated, because we don't know what certain underlying conditions there may be. We don't know what makes one person get more sick than another. And so, yeah, children are not immune. Children do die, unfortunately, from this as well.
Thank you, Dr. Watkins. So with social distancing and the use of a mask, they're all important controls. What needs to happen when we are finally able to go out in public without a mask and enjoy the company of our friends and family? And I do understand the question. Yeah. They want to get back to our old normal, not our new normal.
Yeah, I think that we're going to probably be within a new normal because, we live in a world where there's so much, we live in a globalized world. And until COVID is controlled all over the world, I think that we'll have to, live our lives with that understanding. So there may be an element of wearing masks. Maybe in the winter, folks who work in hospitals, we wear masks around flu season, especially for folks who don't get the flu vaccine. So it may look something like that until we can actually get this thing controlled all over, because people can get on a plane and people can falsify documentation.
And I think I would just say, we're expecting some new guidance from Dr. Fauci in terms of mask wearing outside. And so we'll see what that looks like. But I expect that until we reach that significant level of the entire population being vaccinated, there's still going to be guidance for us to wear masks inside and as well as in large gatherings. So that's what I expect.
Thank you. What happens if you get your first dose and then you have to take a COVID test due to exposure to an affected person before you get your second dose? If you're positive, does your appointment for the second dose affect your vaccination period? Does it have to be rescheduled, and how does it affect your vaccination period?
The recommendation is to wait until your symptoms are gone, or to wait past the infectious period. So wait that 10 to 14 days before you would get that second shot. If the second shot is scheduled within that time, you should actually have it rescheduled. But if it's not within that time, if it's 3 to 4 weeks after, then you can keep that scheduled appointment.
Okay, thank you. What is the medical community doing in order to vaccinate those that are non-ambulatory?
across the country, there's something called like a homebound vaccine effort. I think the Biden administration is also trying to encourage it, but in New York City, for example, we're sending out, folks can register online, and then the FDNY and other groups working in this homebound program are actually going out and vaccinating people in their homes.
And I know in New Jersey.
I'm sorry. This is
Go ahead.
Nikki.
No, go ahead.
I was just going to share that here in the Capital District, many of the home healthcare agencies are actually vaccinating both their staff, like their home health aides, nurses, physical therapists, and their homebound. We also have many of the pharmacies and EMS workers that are vaccinators doing the homebound as well. So we've seen a big push to get those homebounds done, but it's with a variety of ways, not just one way. Yeah.
Yeah, definitely. And in New Jersey, similarly, as was spoken about, we've been working through the county health department, and they have a specific program to deal with patients who are homebound, because the federal allocation dealt with the long-term care facilities, but you have, specific patients who may be elderly or may not fall under the 65 and older, but just who are not able to leave their homes. And so the local health departments are working with healthcare providers to have people go out into the home, and that's why one of the reasons that the J&J vaccine was so important.
Thank you. I have one last question for our speakers. We're getting close to time, but does the vaccine really provide immunity to the disease, or does it just lessen the seriousness or the impact of the disease on an individual?
I can go first. It does both. There was a recent study that was published at the end of March that followed healthcare workers who are taking care of people sick with COVID, and they followed them for 13 weeks. And it showed 90% effectiveness in reducing transmission, like preventing infection. And then we also know from the clinical trials that people who are vaccinated, if they do get sick, those folks, nobody died who was vaccinated. People were not getting severe illnesses, and people were not hospitalized. So it does both of those things really well.
Yeah, again, I agree 100%. Nothing to add.
Very good. Well, I can't thank Ms. Jimenez, Dr. Watkins, Dr. Campbell for taking the time, for joining us today, and for answering everybody's questions, whether or not they seemed important to the whole or not, they were important to individuals. We do host webinars at FEMA Region 2 on a pretty regular basis. There are a few of the upcoming webinars on the screen, including one coming up on child abuse and one on vaccine fraud and scams from the FTC. All of our webinars can be found by clicking the first link on the screen. Today's webinar has been recorded along with all our previous webinars and can be found on the FEMA.gov site as well as the FEMA Region 2 site. So if you didn't catch the whole thing, or you know of somebody, a friend or a family member, someone in your community who would benefit from listening to these professionals talk about the misinformation that's out there, then please share the recording link. If you don't already subscribe to FEMA Region 2 News, we do send out a preparedness and resilience bulletin every 2 weeks, as well as a weekly announcement with all our upcoming webinars. Any comments or questions about today's webinar after the fact, feel free to email our team in preparedness at the region at FEMA-R2-prepares. Thank you, everyone. It is 3:31. You're free to drop. Have a wonderful day.